Yeah. Hi students, I am Dr. Badrinath, and in this video, colorful video, we will see a thyroid preparations which works along with the thyroid hormones, which works against the thyroid hormones. So many preparations are there, that preparations that we are going to be see in this video, right? Yeah, thyroid preparations is the topic. See, thyroid preparations are, I divided into two types. First one is thyroid analogues, which supports the thyroid hormone, which see here, I wrote here thyroid analogues. It is nothing but thyroid preparations. Looks like a thyroid hormone. It also not only looks like, it also works like a thyroid hormone. It is nothing but thyroid hormone, you can say. Either it is a prepared synthetically or whatever it may be. All thyroid analogues are works like a, looks like a thyroid hormone. It is nothing but thyroid hormone. Okay. Hence, when we are using, use it in a hypothyroid. Very important, because thyroid gland is not functioning. Okay. So when thyroid gland is not functioning, T3, T4 release is not there. Okay, then what you have to do, you have to do an alternative and you have to take it some other way. Orally you have to take the hormones. Okay, that's why these are used in the thyroid hormone deficiency. All these are the same names: thyroid analogues, thyroid preparations. Looks like, works like, used in hypothyroid. Okay, used in thyroid hormone deficiency. Whereas here you come here, these are also thyroid inhibitors. See, these are called as a anti-thyroid preparations. So it is also thyroid preparation only. See here, thyroid preparation only, but it works against the thyroid. So these are the tablets or chemicals, whatever it may be, any biological substance or any synthetically prepared or recombinant, whatever it may be. Anti-thyroid preparation. It works against the thyroid hormones. So used in the hyperthyroid. Whenever there was in the body, your thyroid gland do overaction or excess secretion of the thyroid hormones, you want to stop that. When you want to stop that hormones, you take the thyroid inhibitors. Okay. So used in the hyperthyroid, thyroid hormone excess secretion. Very, very important. So pharmacology of drugs which are acting on endocrine system. This is your syllabus as per your university pharmacology subject. Thyroid hormones. See here, this is the point we are going to discuss. Analogues and their inhibitors. Yeah, now first we will see this part. Later we will see inhibitors. First we will see thyroid analogues, which works like a, looks like a thyroid hormone. Is there anything apart from thyroid gland? Okay, that we will see. Yeah, first preparation is L-Thyroxin sodium. I have already told you, giving the trick also. Thyroxin X is there. X is having a 4 ends. Okay, that's why T4. It is also called as a T4. Triiodothyronine. 3 is there. 3 iodine molecules. T3. Okay, T3, T4. These are the tablets. See, L-Thyroxin sodium. For easy solubility, they will add a sodium salt. Whenever they will add a sodium, solubility will be increased. Oral bioavailability of L-Thyroxin is 75% only. 25% will be destroyed in the liver before entry into the systemic circulation. If you are taking a food also, food alters the absorption. So food interaction is there along with the thyroxine. So how to take that is, see, sucralfate, iron, calcium, proton pump inhibitors also reduces the L-thyroxine absorption. So don't give these combinations, don't give. Very, 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 very important. Okay, sucralfate, iron, calcium, proton pump inhibitors, don't give. And also avoid the PRC, polymeric chain reaction, that you keep in your mind. PRC. PRC means, P means phenytoin, R means rifampin, C stands for carbamazepine. Okay, rifampicin, phenytoin, carbamazepine. They accelerates the metabolism of T4. So T4 will be metabolized in the body immediately. You are taking this much of T4. If you are using these drugs, it becomes small. Okay, so don't give with such a combination. Okay, food is important. Salts, what you are using, salts also important. So some avoid. Yeah, this is a one of the very popular preparation, thyroxin sodium. It is an example. It is brand name is Thyronorm. It becomes a thyroid. It makes the thyroid gland normal. Like that you can feel, because it is nothing but thyroid hormone only. Okay, Thyronorm. So you will become a normal. Your thyroid gland become a normal. That's why they have kept very nicely this name, Thyronorm. 50 mcg is there and prepared by very popular company Abbott Laboratory. See this symbol, Abbott. And here you can see iodine. Whenever there was iodine deficiency in your body, thyroid gland will not work properly. So you take iodized salt. Instead of taking a normal salt, you take prefer the iodized salt. Yeah, these are the various preparations of your Thyronorm, various strengths. See, 25 mg is there, 50 mcg is there, microgram. Mc means not milli, mcg, micrograms. 100 is there, 125 is there, 150 is there. If the thyroid gland is not at all functioning, okay, then you have to give a 150 mcg. Like that, different strengths are there. All are prepared by Abbott Laboratory, very popular, very successful brand. So when we have to use this thyroid hormones, alternative, when you are, see, whenever your thyroid gland is not working, main thing happen is the cretinism. See this one, cretinism. What is this cretinism? Cretinism is nothing but a dwarfism plus mental retardation. Both are collectively called as a cretinism. Cretinism is due to the deficiency of thyroid hormone. Don't get confusion with the dwarfism. Dwarfism is the pituitary hormone deficiency. Pituitary hormone, master gland deficiency. So it is a physically retardation will be there. Whereas here, dwarfism, physical plus mental retardation, both. Keep in your mind. Okay, physical retardation, dwarfism, physical retardation plus mental retardation called as a cretinism. Cretinism is mainly due to the deficiency of thyroid hormone. Cretinism. So we are using these preparations. Thyroxin 8 to 12 micrograms per kg daily dose should be started as early as possible. That is very, very important. Otherwise, the growth, your growth will be like this. Okay, these are the cretinism, dwarfism plus mental retardation. Number two, so the first uses are, we are going on searching the uses. First is cretinism as per your pharmacology Tripathi book. Second use is adult hypothyroidism. See, hypo. Since the thyroid is hypo, we are using analogues, alternative. It is also called as a Myxoedema. Very important bit. In competitive examination, definitely this bit is very important. Myxoedema. Treatment with T4 is most gratifying. It is often wise to start with the low dose, 50 micrograms you have to start, and increase every 2 to 3 weeks on the optimum of 100 to 200 micrograms per day. These are the symptoms of myxoedema: hair dry, coarse, very coarse hair, sparse, okay, lateral eyebrows. It becomes very thin. By seeing the eyebrows itself, they will, some doctors will say, okay, like that. And edema, periorbital. See, periorbital, that you know very well, orbital, and that is related to eye. It here swelling will be there. Edema will be there. And puffy and dull face with a dry skin. These are all called as a myxoedema. Myxoedema coma is different. Again, see here, myxoedema coma. This is a third usage. Here also you have to use a T4, thyroxin sodium. 200 to 500 micrograms IV followed by 100 mg. This is a very severe hypothyroidism resulting in the decompensated metabolic state. Mental status change. Mental status, very important. Mental status will be changed in the coma, not the ordinary coma. Myxoedema coma. Thinning of hair, hair loss, puffy face, dull face, enlarged thyroid, loss of eyebrow hair, bradycardia, your heart, and poor appetite, and a non-toxic goiter. This is a goiter. Your thyroid gland will become enlarged. So you will become something was there in the neck, like that you can feel. Non-toxic goiter. That is also one of the important thing where you have to give a thyroid hormone. And thyroid nodules. See here, this is a nodule. Thyroid. This is ordinary thyroid gland, healthy thyroid gland. Here you can see the nodules. See here, observe. And thyroid cancer also. Carcinoma of thyroid. In such a case also, you can use these preparations. Next, empirical uses. This is also very important. Refractory anemia, blood loss, mental depression, menstrual disorder, infertility. In pregnancy, this is a very, very important step after marriage. Infertility for ladies, especially the thyroid checking is there. If thyroid problem is there, pregnancy is not easy. That keep in your mind. Corrected by the usual treatment. And chronic non-healing ulcers. See, ulcers are in the stomach. We are giving a thyroid preparation for ulcers. Just imagine. And constipation. And thyroid preparations, we will see thyroid inhibitors, anti-thyroid preparations, which works against the thyroid hormone. 1, 2, 3, 4 are there. Inhibits the hormone synthesis. See, these inhibitors try to stop the hormones. It blocks any step of the thyroid hormone, either synthesis or release or iodine uptake, whatever it may be. So 5 steps I have already told in my last video how thyroid T3, T4 are prepared in the thyroid gland. In that 5 steps, the 5 steps will be blocked by this drugs. First one inhibits the hormone synthesis. These are the drugs. That's why this is called anti-thyroid drugs. Drugs is a keyword here. These are the preparations. This is called as a drugs. Okay. Propylthiouracil, methimazole, carbimazole. Okay, just like a CPM. Keep in your CPM party. Very, very important party for those. Okay, CPM. And inhibits the iodide trapping. See, iodide trapping is the first step in the synthesis of T3 and T4. That this is called as a ionic inhibitors. Thiocyanates, perchlorates, nitrates, these three are inhibits the iodine uptake by the gland. So when it stops, there is no T3, no T4 synthesis. Next is inhibits the hormone release. Iodides. These two you don't get confusion. Inhibit the iodide trapping, ionic inhibitors. Here you can see iodides of sodium, potassium, organic iodides, destroy the, and see whenever this fourth preparation is very important. It destroys the thyroid tissue itself. That is radioactive iodine. That's why my picture I have shown in my starting slide. That is I will explain you. Radio iodine, iodine 131 is very, very important. Iodine 125, 123 are also there. 131 is very important. Thyrotoxicosis, excessive secretion of thyroid hormones. See, if thyroid hormone T3, T4, if it is releases excess, Graves' disease will come to you. Toxic nodular goiter also there. Goiter means enlarging of thyroid gland. So these are the symptoms. Exophthalmos, your eyes will come be protruded towards the laptop. It protruded. Okay, exophthalmos. Nervousness. Here you can see the nervousness. Sweating. See how this fellow is sweating. Goiter. All these are the toxic nodular goiter. In such cases, you can get. Yeah, very important diagram. How thyroid inhibitors will works. Iodine uptake. What I have shown here, these steps you can find in the diagram. Iodine uptake by the thyroid gland will be thiocyanates, chlorate, perchlorates. Next is which avoids, this is having a negative symbol. See here, this avoids the iodides, thioamides, stops the conversion of iodine into MIT into DIT. Next, iodides. This iodides inhibits the proteolysis iodides. Okay, so T4, T3 will not be start. And this peripheral conversion of T4 into T3, peripheral tissue, it will be avoided by the radio contrast media, beta blockers, corticosteroids, and aminodarone. Yeah, here you can see the anti-thyroid drugs. These drugs are used to bind the thyroid peroxidases and prevents the oxidation of iodine. Okay, that's why it is called as a peroxidases. Binds with peroxidase, which is important for the oxidation of iodine. That will be stopped by this. Inhibits the iodination of tyrosine. Inhibits the coupling. Coupling I have already told in my first video. What is coupling? Iodotyrosine reduces to T3 and T4. And these are some of the pharmacokinetic parameters. The most important side effects, you can underline this. Okay, agranulocytosis, very, very important. Number of times it was appeared. Agranulocytosis, very rare side effects. Intolerance, skin rashes, joint pains, and uses of these preparations. These long-term treatment of thyrotoxicosis. Okay. And with the T4, this third point is important. With I-131 to hasten the recovery of thyrotoxicosis. Yeah, these are some of the differences between the propylthiouracil and carbimazole. Antithyroid drugs. Propylthiouracil, dose to dose, less potent. Here, adult 5 times more potent. This point very important. Carbimazole, how many times it is more potent than the propylthiouracil? 5 times. Highly plasma protein bound, less plasma protein bound, less transferred across placenta in milk, larger amount of cross like that, plasma, okay? No active metabolite. It produces active metabolite, okay? Multiple daily doses needed. Mostly single dose is needed. Does not inhibit the T4 to T3 conversion, whereas here this inhibits the peripheral conversion of T4 to T3. And ionic inhibit blocks the uptake of iodide. Thiocyanates also inhibits the iodination as high doses, and highly toxic effects are there because it is a cyanide, thiocyanate. Cyanide very dangerous. That's why it is highly toxic. Iodine and iodide, there is some excess iodine inhibits its own transport. Okay, that you know very well. Negative feedback mechanism attenuates the thyroid stimulating hormone so that your gland will work very less. And these are some of the adverse effects. Acute reaction and chronic overdose, not much important. This is called iodism, chronic overdose. Yeah, this preparation is very, very important. Radioactive iodine, it is indicated by the symbol of I. And here in the C, in the capsule, you can find the iodine granules. These iodine granules, and it is indicated by the fan. This symbol is called, stands for radioactive substance. It releases the beta rays and also gamma rays. Very, very important. Not alpha. Don't write X-rays. Don't write alpha rays. Gamma and beta rays. And this iodine 131 and 53, you have to write like this in the exam. Iodine 131, it is nothing but mass. Mass means, you know, protons and neutrons. When you combine, you will get a mass. That we are writing here. 53 is nothing but protons. You know that electrons having a weightless, doesn't have any weights. Okay. The most widely used iodine. See, this is iodine and it works against the thyroid. This is anti-thyroid preparation. How this? This radioactive iodine, whenever you are giving the patient will take, iodine will enter into the blood. That iodine will be trapped by the thyroid gland. There in the thyroid gland, this radioactive iodine releases the gamma rays, beta rays here. It will be trapped very nicely. So that whenever it releases, no, the thyroid tissue will die. That is actually we want, because excess of secretion of thyroid hormones we are going to avoid now. That is our aim target. Okay. So we can be achieved it by, it is just like a surgery. You can say surgery, how you are removing in case of overaction of your thyroid gland. Instead of doing a surgery, you can give radioactive iodine. Okay, go and see it here, and it releases the thyroid gland because iodine will be entrapped by the thyroid gland. Okay. The most widely used iodine is radioisotope. This is radioisotope iodine. Emits the gamma rays, beta rays. Okay. It deposits in the energy in tissue and causing the damage to the thyroid gland. Yeah, here you can see the product. This product consists of here see capsules. See my cursor. All these capsule, one capsule I enlarged here. This capsule. See, yellow color and fan is there. This is this color and fan is symbol for radioactive substances. And half-life is 8 days. So very good. Half-life 8 days. Emits the gamma rays and beta rays. Okay, radioactive iodine administered as a sodium salt of sodium salt. We are taking orally capsules. We are taking slow acting. It causes a local soreness in the neck. Okay, it kills the thyroid tissue. Advantages: treatment with 131 iodine is simple, conveniently given to outpatient on the basis of inexpensive, no surgical risk, no surgery, nothing, only capsule. Injury, parathyroid glands, no injury to parathyroid gland, because whenever they are doing a surgery of thyroid gland, there is a chance of risk of cutting off parathyroid gland also. That point can be, you can avoid by the this one, iodine, radioactive iodine. Cure is permanent. That is also important. Once the hyperthyroidism is controlled, okay, cure is permanent. And this is a thyrotoxic crisis. It is also called as a thyroid storm. Okay, this is the emergency due to the uncompensated hyperthyroidism. Overaction of thyroid gland leads to thyrotoxic crisis. In such a cases, you have to give all these preparations. Treatment: hospitalization first, supportive care, propylthiouracil you have to give, anti-thyroid drug. Okay, and you oral iodides you have to give it, propranolol, because heart problems are there, no, in it causes a problem to heart, cardiac arrhythmias. In order to correct this cardiac arrhythmias, you are giving a propranolol. Okay, and paracetamol you are giving. Okay, this is the treatment. Okay, so I will end here. You see my playlists, my channel's playlist. There I have kept everything, all the subjects, all pharmacy subjects. Okay, subject wise.